The United Nations is asking governments that as the pandemic crisis drags on, not to forget the mental health toll that is having on many people. Devora Kestel, director of the World Health Organization's Mental Health Department, said an upsurge in the number and severity of mental illnesses is likely, and governments need to be front and center in their responses.
We have seen in the past that similar cases of economic crisis have increased the number of people with mental health issues, leading to high rates of suicide, for example, due to the mental health condition or the substance abuse, for example. Some surveys that were done in Canada, where 47% of healthcare workers reported need for psychological support. 47%, so almost half of them.
The report highlighted several groups that are vulnerable to mental distress. These include children and youth who are isolated from friends and school, and healthcare workers who see thousands of COVID-19 patients. Domestic violence is also rising, and health workers are reporting an increased need for psychological support. The WHO report said many people are distressed by the immediate health impacts and the consequences of physical isolation, while others are afraid of infection, dying and losing family members. Millions of people are also facing economic turmoil, having lost or being at risk of losing their income and livelihoods, it added. The report outlined action points for governments to help ease this burden, including addressing past underfunding of psychological services and pushing online resources such as video conferences with therapists.